Hi, Joseph P.S. This is from Health Services Office. And for this session, we are going to share you some information that will help us to increase our awareness about COVID-19. We will also identify some basic preventive health measures and the facts and myths of COVID-19. But before that, let me ask you a question. Kung walang COVID-19, sa tingin mo, nasaan ka sana ngayon sa mga oras na ito at anong ginagawa mo? Kindly type your answer in the chat box and we will read it later after this session. So now, let's begin.
From World Health Organization, coronavirus disease, COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. So, as of now, wala pang medicine for this disease. No proven medicine yet. So all our experiments, older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. So this will be discussed later. Why? Signs and symptoms of coronavirus, COVID-19. People with COVID-19 have a wide range of symptoms ranging from mild to severe. Symptoms may appear 2 to 14 days after the exposure to the virus. People with these symptoms may have COVID-19. So, common symptoms includes, of course, number 1, fever. Fever and chills. Cough, shortness of breath, fatigue, muscle or body aches, headache, loss of taste and smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So if you will notice, guys, fever until nausea and vomiting are flu-like symptoms to be exact. So because what causes flu is actually another type of coronavirus, but not necessarily COVID-19. So coronavirus are family of viruses. So COVID-19 is one of them. Okay. Although some may experience mild to severe symptoms, others are asymptomatic. So what are asymptomatic? Asymptomatic, to simplify it, it means absence of signs and symptoms. So it doesn't mean that you have no symptoms, you are no longer contagious. Even asymptomatic patients are still highly contagious and requires proper management. And it need to be quarantined and isolated because to minimize contamination. How is it transmitted? It is transmitted through droplet. What is droplet? Okay, it occurs when a person is in close contact 1 meter with someone who has respiratory symptoms such as coughing, sneezing. So droplets, sila yung mga parang particles na nagiging aerosol when we cough or sneeze. So saliva, mucus, yun. These droplets containing the COVID-19 virus enters your mouth, eyes, and nose. then the cycle of transmission is completed. That is why we are required to wear face masks and face shields to shield ourselves from these droplet infections. So it is also advised avoid touching mouth, eyes, and nose. In short, men, para mas madaling matandaan. Okay? Because droplets containing the virus may get into our hands after a contact with everyday things such as doorknobs, stair handrails, handles. So some people, when they cough or sneeze, they tend to cover their nose with their hands. So without proper coughing and sneezing etiquette, after doing such, and then they hold doorknobs, um, stair handrails, and handles, and someone, if that person has COVID-19, if another person touches the things which has the particles of COVID-19, and then transmission is very high. So yun, droplet transmission. Who are at risk or at higher risk for COVID-19? So, sino ang pwedeng mahawaan? Actually, everyone is at risk for acquiring COVID-19. If we are exposed to the virus, some people are more likely than others to become severely ill. So there's no age exception, no racial exception in this. Everyone is at risk for having COVID-19. But yun, elderly people, as we age, there are physiological changes associated with it, including a decrease in immune function. That's why they are more susceptible of acquiring the disease. And mas severe ang nakukuha nila. Usually, the mortality rate much higher in elderly people. Also, those with underlying medical conditions, because their immune system is already weakened. This includes chronic kidney disease, COPD or chronic obstructive pulmonary disease, immunocompromised patients. Though immunocompromised meaning problems with immune system, obesity, heart conditions, sickle cell disease, diabetes, asthma, hypertension, neurologic condition, yung may problema sa nervous system, liver disease, pregnancy, and smokers. So these people which has the higher chance of more severe COVID-19, and much easier to be transmitted COVID. So how is it diagnosed? This pandemic, you heard this maybe more than 100 times already, but we will just make a quick recap. How is COVID-19 diagnosed? There are two tests, the rapid test and the swab test. So let's start with rapid test. Rapid test, before I can explain what rapid test is, first we should know how our body function. Okay. The body produces antibodies in response to an infectious agent such as virus. In rapid test, presence of these antibodies are detected. This may result to a negative result, especially to those who have delayed immune response. So this is not an accurate, because the immune response may be delayed. It may take 2, 3, or 4 days before these antibodies are present to those who were just recently infected with COVID-19. So in people with immunocompromised situation, so this may indicate a false negative. That's why many people may be negative in rapid test, but after a few days, symptoms appear, and in swab test, they are already positive COVID-19. How is it done? Blood sample is taken from a patient, then analyzed with a test kit. So the results are fast. Next, we have swab test. This is the accurate test. In swab test, it determines the presence of the virus itself, which has 97% accuracy. How is it done? A long swab is inserted far into the nose, may cause momentary discomfort. So we will not dig deeper into this. And I'm just showing you an parang summary. Okay? So this is the most important part, actually. The preventive measures. First, wear mask properly. Yes, we wear our masks every day because to comply with government standards, but do we wear it properly? So mamaya we will discuss on how how to wear it and how not to wear it. Okay? Syempre, hand washing and sanitizing. Because kanina I said may there's a chance that we may have contact with contaminated everyday things na pwedeng infected with droplets. So this is very important. And social distancing. Ang walang kamatayang social distancing. 1 meter. Kasi nga droplet transmission. So the further we are, the lesser the chance that we will be acquiring the disease. Stay home. If ano man lang, walang important matters, please stay home. There is a higher chance that we can be saved from COVID-19. Just don't stay home sa may mga COVID na patient. Okay, ito na tayo. Proper wearing of mask. Dito, sa first image, on the left, the mask is in the chin. So, nagmask ka pa. Your nose, your mouth is exposed. So, your mask is totally useless. Second image, you cover your mouth, your nose are exposed. Same thing. Nagmask ka pa. It's useless. The correct way of wearing mask is yung last image. Yun. The mouth and nose are covered. Blue out, color out, white side in. Dun sa common medical face mask. Why? Wearing face mask the wrong way will reduce your comfort, as you will be exhaling into the outer hy- hydrophobic water repelling layer instead of inner absorbent layer. So mas mahirap huminga. Mas mahirap huminga if baliktad yung mask natin. Myths. Yun na. This is from DOH, so it's in Tagalog, ano, but siguro maintindihan naman natin. So this is the DOH, yung pinaka-legit na source natin. So, fact or mythbuster number 1. Makakakuha ba ako ng COVID-19 sa packages mula China? The answer is no. Although, as I said before, na droplet infection, droplet transmission, but in surfaces, di siya hindi siya nagtatagal sa bagay or gamit. Oh. Pero, pwedeng maging present pa din. Eh kung if that's packaged from China, it already stayed too long. Okay? So makahawaan ba ng COVID-19 ng mga alaga kong hayop sa bahay? So as of now, walang evidence na nagpapatunay that pets such as dogs, cats ay pwedeng makakuha ng COVID-19. But we are still reminded to be careful, take care, always wash hands after we handle our pets. Kaya ba akong protektahan ng bakong kontra pneumonia laban sa COVID-19? So the vaccine for pneumonia is different from COVID-19 vaccine, which is still being developed right now. So iba po, there's a big difference. So that doesn't protect you from COVID-19. Then, ang mga nakakatanda lang ba ang maaaring magkaroon ng COVID-19 o kasama rin ang mga bata? We discussed this already before. Everybody is at risk for COVID-19. Much higher risk lang ang mga matatanda and yung mga immunocompromised people. So, epektibo ba ang antibiotics at paggamot, pag-iwas at paggamot sa COVID-19? Actually, hindi. Kasi bacteria sa antibiotics is for bacteria, not virus. Ngunit kung ikaw ay ma-hospital dahil sa COVID-19, maaari kang uminom nito upang maiwasan ang pagkakaroon ng infeksyon sa bacteria, but not in COVID-19. So again, even sa medications, it's still being researched and developed. There is no proven medicine yet. There are many theories, pero walang proven. So dapat it's from WHO, FDA, and from DOH. So that's all. Thank
All
you.
right. Thank you, Nurse Stan, for sharing your knowledge and information about COVID-19 to our dear Josephians. We are all praying and hoping that this pandemic comes to an end soon. Please stay safe, everyone, and God bless you all.